Did you know that 75% of applications that are submitted are never seen by the hiring manager? Why is that? That's because people are not writing their resume to two different audiences. One is AI, the applicant tracking system. This is the very first audience that you are writing your resume for in the first part of the battle. And the second is humans. This is hiring managers and recruiters. And for this audience, you are speaking to the pain points and challenges of working in the position so that they can feel that you are one of the best candidates for the position and actually call you in there for an interview. So when you're writing your resume, you must write your resume for both audiences. And today we're going to make sure that you are not a part of the 75% of people who are submitting applications and not getting any call back for interviews. I'm Valerie Page, registered health information technician, and I have 19 years of experience inside of the healthcare industry. And today we're taking a deep dive into 3 of my 27 resume writing strategies that will help you to stand out from the crowd even when you lack experience. Stay tuned. All right, so let's get this ball on the roll. So many job seekers, particularly those who are new in the healthcare industry, have a difficult time writing a targeted resume. I cannot tell you how many times I receive messages from people saying that, hey, I don't have much experience. I don't even know how I'm even going to begin to write a targeted resume when I feel like I have nothing to leverage. You talk about your unique career advantage and, focusing on a specific career path and niching down, but I don't even know where to begin or what to say inside of my resume. And why is that the case, right? Let's talk about why is that the case. I personally believe that this struggle comes from people graduating from universities or community colleges or some vocational training programs that do not have the career resources that we need to really hit the ground running. Some of the folks who are working inside of the career resources department do not have a healthcare background, or some of them are just using like outdated resume tips, right? I cannot tell you how many times I've heard of the saying that your resume should only be 1 page long or should only be 2 pages long, especially if you don't have a lot of years of experience. Now, what I will say is when it comes to resumes that are longer than 3 pages, 4, 5, 6 pages long, and the saying of, a hiring manager or recruiter will not read a long resume, that is 100% correct. I 100% believe that as well. A hiring manager is not going to read an extremely long resume. That's why you structure your resume in such a way that the most important information is either on the very first page or the first 1/3 of your resume, where they're going to focus their time and attention when a human, the second audience, is reading your resume. But when it comes to the very first audience, remember that is our first order of business. That is the first part of the battle. When it comes to the very first audience, which is AI, the applicant tracking system, that will read every single page of your resume. I've never heard anything about an ATS system reading the first 1 to 2 pages of a resume and then stopping there. It does not stop. It will read every single page and it will read every single word that you have in your resume. When it comes to keyword matching and having the highest possible resume score, you want to make sure that you are putting detailed information in there. And if your resume does go into 2 pages, if you have no experience, the world is not going to end. I promise you. It's not going to end because your resume is longer than 2 pages long. But it is my personal belief that this is a part of the reason why some entry-level folks struggle with resume writing, and even individuals who have mid-level of experience and even some executive levels not knowing how to write their resume. So here what I have on the screen here is the resume example that we're going to be using for this video. I have Tiffany Doe here. Now I have resume templates that are, very well designed, aesthetically pleasing, that plays into the whole racker resume method. But I like to write resumes on a Word document. And then if I do decide to use one of my racker resume templates, then I will copy and paste the information over onto the resume template. So I decided to use the resume template versus using the Word document. The resume templates come in really handy when you're trying to get all of that information on the very first page of the resume, like I mentioned before. It has all the skills, the education, contact information, the professional summary, career highlights, and it goes into the professional experience on the very first page of this resume. So I did want to show you the 2 different versions that we have here. And in addition to that, I just wanted to show you guys this resume template that's online for an insurance verification specialist. That's going to be today's demonstration today. We are going to take a resume template for an insurance verification specialist, for someone that will be trying to apply for that position, and looking at the difference in the resume scores for the resume version that I've written and the resume template that's listed online, just a general one. And some people use general resume templates online, and I'm like, they may not have all of the information that you need inside of that resume template, and they may not even know where to even begin to point you in the right direction of how you can write a better version of your entry level resume if you were trying to get into an insurance verification specialist position. And the Rack a Resume method is something that you will not find anywhere else. It is resume writing tips and strategies specific to the healthcare industry. So one of my personal favorites for identifying relevant keywords inside of job postings is using Jobscan. This is my absolute fave. I do not use any other product or service when it comes to keyword matching. And while it may be great for you to manually know how to read through a job posting and identify what the keywords are, using something like Jobscan is the ultimate time saver. So what we're going to do here is copy and paste the job description into Jobscan. And when I copy and paste job descriptions into Jobscan, I'm making sure to just pay special attention to the job functions, requirements, and abilities, education requirements, certifications, things of that nature. So you do not need to copy and paste into Jobscan anything about like location, the description of the company, how much they're paying. That information does not need to be copy and pasted over into Jobscan. So just the critical information that you need to have inside of your resume that states what the job duties and responsibilities are, as well as the requirements. And then I am going to copy and paste in the sample resume that we have over here for Tiffany Doe, just starting with the professional summary section all the way down to the relevant education. So let's copy and paste this over here, as well as this. All right. And so then now I'm going to click scan. And Jobscan is going to analyze the resume against the job description, looking for any keywords that are inside of the job posting to be inside of the resume as well. And based on the information that is provided, it will give you a score ranging from 0 to 100%. So I like to say, think of this resume score as on a grading scale. So anything that is below a 70%, honestly, is a failing grade. Okay. You want to aim for a 75% match or higher for the best possible chances of making it through the applicant tracking system and a fighting chance to impress the hiring manager and possibly be selected for an interview. Now, there's going to be a few more things that I fill in here just to make sure that we get the max amount of points based on what we currently have in this version of the resume. So missing scan information. So I'm going to put in the correct job title. It is Insurance Verification Specialist, and this is at Metro Community Health Center. And I'm also going to grab the URL to the job posting. Okay, let's go ahead and add in the personal information just so that we're making sure we're getting as many points as possible. Because Jobscan, it most definitely will score you on that as well if the information is missing from your resume. So let's just go ahead and put that in there. Okay, so now we got the green check marks for the contact info. And so with that information being placed in here, now I'm going to come in and I am going to look at the keywords that are listed as missing inside of this resume. And some of this could just be a matter of just going into more detail inside of the bullet points or inside of the professional summary in the current version of the resume that we have. So if you've ever heard someone say that you need to target your resume every single time you apply to a different position, you shouldn't be using the same exact version of your resume when you apply for different jobs, that doesn't necessarily mean that you are writing your entire resume over from scratch. There may be just little minor changes that you have to make to your resume before pressing that submit button. So it could be something as simple as just changing what you're saying inside of your professional summary. So just looking at the keywords that are listed here, let's see, like revenue cycle, HIPAA regulations, educating patients, commercial insurance, healthcare administration, verify insurance coverage, medical billing. Like even with insurance verification being the job title, if you just think about how this ties into medical billing, you can even just say something as simple as making sure performing insurance verification accurately to ensure accurate medical billing, right? So let's just change up the professional summary a bit. So I'm going to say motivated and detailed oriented professional with a comprehensive understanding of health insurance coordination. Let's put this down. Let's do including commercial insurance and revenue cycle management. Okay, management. Let's put this up. Gained through CMS National Training Program on coordination of benefits, skilled in determining the order of payers for Medicare and insurance coverages, ensuring accurate billing, and and adhering to HIPAA regulations. And then let's say proficient in verifying insurance coverage and educating patients on health administration. And let's bring this back. Eager to apply knowledge and skills to a patient registration role to ensure seamless registration, insurance verification. Let's do insurance verification processes. Yeah, insurance verification processes. Enhancing patient care and primary care delivery. Right now, what I'm doing here is a play on, the keywords. I'm saying things and wording them in such a way to get these keywords in here so that it helps to increase the resume score in an effort to making it through the applicant tracking system. Okay, that is the whole goal here. So I'm going to play around with the keywords to see if it's going to increase the resume score. Not making major changes inside of this resume. I just only made some changes here to the professional summary. So now I'm going to come back to Jobscan. I'm going to do upload and rescan, and I'm just going to come to the professional summary section, and I'm going to plug that in to see how it changes. All right, that took the resume score from 51 to 68. So now I'm just going to come down and see if there's anything else that I could possibly add in. Behavioral health is very specific. So if this is someone with no work experience prior and they don't have any experience in the behavioral health department, then this is simply going to be a keyword that's going to have to stay off of the resume, because we don't want to add in any keywords if you really don't have anything to back it up like at all, if you haven't worked in this area. So medical billing is missing. I think medical billing and healthcare settings are two that we could get in really fairly easy. And then also work independently. If you're somebody, who can work independently, that can be like fair game. So let's just say professional skills. That would be a matter of just adding in the skill here. Works independently. Let's see, enhancing patient care. Let me do Control F on my keyboard to see where I have healthcare inside of the resume, because I kind of want to see if there's somewhere where I could just like plug in healthcare settings. And right here, I'm going to put in healthcare settings. I'm just going to add it to the bottom of this sentence. Knowledgeable about coordination of benefit rules to prevent billing errors and ensure compliance with healthcare regulations and healthcare settings. Or we can word this like in healthcare, because I don't want to say healthcare twice. So in healthcare settings, and to ensure compliance within healthcare settings. And then let me see if I have regulations somewhere else. Okay, so I just wanted to make sure that when I took out that keyword regulations, that I wasn't completely removing it from the resume. So since regulations is listed somewhere else inside of this resume, I'm just going to leave it as such and then try to see if this increases the resume score some more. So I'm just going to go ahead and grab everything again, copy and paste it over. And while doing something like this can be a bit time consuming and tedious, I 100% rather you take the time targeting your resume, going back and forth like this, than to spend hours on end applying for jobs that you're not getting callbacks for interviews, right? I much rather you take the time doing this, targeting your resume, pinpointing it back and forth until you get this green circle that says that you're in the green light, you're ready to go, than for you to just randomly keep applying to different job opportunities with an untargeted version of your resume and not being selected for interviews. So it's not just only about the keywords that you're using inside of your resume, but how you're using these keywords inside of your resume. You want to make sure you're using the right keywords to make it through the applicant tracking system, but you also want to make sure that you are speaking to the pain points and challenges of working in the position, and that the hiring manager will actually be interested in calling you in for an interview. Now, this takes me directly into the next item that I want to share with you guys, which is CMS National Training Program. But before I hop into the CMS National Training Program, I just wanted to share this with you guys first as far as the keywords and how it doesn't have to be really hard for you to identify what the keywords are inside of a job posting. But you should be keeping track with the keywords that you most commonly see inside of the positions that you're interested in applying for, the ones that you see over and over again all the time with different companies, no matter what it is. If it's the same position, so let's just say insurance verification specialist, and you look at 10 different job postings at 10 different companies, and in each one of these job postings, it mentioned revenue cycle, it mentioned commercial insurance, it mentioned verified insurance coverage. That means that these are keywords that you need to have inside of your resume. And if they are not inside of your resume, more than likely your resume is not making it through the applicant tracking system, and the hiring manager never knew that you applied for the position, because the applicant tracking system automatically parse your resume and put you in the stack of individuals who's not going over to the next round of further review and consideration. So getting the right keywords inside of your resume is extremely important. Now, did you know that the CMS National Training Program website is a treasure trove of resources developed with federal funding, meaning it's freely available for public use? This was created with taxpayer dollars, meaning that you and I have already helped to pay for this free resource. Now, I like to call it CMS the law of the land when it comes to healthcare rules and regulations, when it comes to compliance and reimbursement for services that are provided, patient safety, all those good things. But there are free training resources that they have on their website. They don't create all these rules and regulations that we must abide by and don't give us all of the resources at our fingertips to make sure that we are knowledgeable of how to implement them and be in compliance. And I mean, there's just a treasure trove of information here inside of this program that a lot of people do not know that this is available, like right at your fingertips. This open access to this resource here is crucial for anyone looking to enhance their resume with a trusted and authoritative figure in the healthcare industry without incurring any additional costs. And like I just said, if you think about it, technically you've already paid for it. This was created with taxpayer dollars. So sticking to the example that we are currently using, let's say you're someone who is trying to get into the healthcare industry and you have no experience at all, or very limited experience, or when it comes to the education standpoint, maybe you're just interested in getting in, but you haven't officially enrolled in a program, or maybe you've already gone through a program or something and you just need a refresher, or somebody who's been out of the industry, you're trying to get back in. You can come over here to the CMS National Training Program, and you can look at their full catalog of resources. Okay, so if you click on the full catalog, you will see everything from their workshop, live events, e-courses. They have a podcast, like it's filled with a lot of information. Now, I wouldn't say that it covers everything 100% as far as health information management, but there's a lot of great resources in here that can get you started. Now, you will have to create a profile if you decide to use this. And again, that is totally free, but you will have to create a profile in order to get in here and start reviewing some of the course materials that they have. So I'm going to click over here to e-courses. And again, sticking to the example that we're using, let's say you're someone who's trying to get into patient access, patient registration, insurance verification, something of that nature that really does not require for you to have a lot of years of experience, any degrees or certifications whatsoever. You can add something like this up under your belt, relevant coursework that is going to be very valuable on your resume. So as we can see here, they have an e-course for coordination of benefits. And this course explains how and when Medicare coordinates claims payments when a person with Medicare has other insurance. So it's a 30-minute course. You do have to review the entire course, and then there is a course evaluation that you have to complete. And then once you complete the course evaluation, it will issue you a certificate of completion. So this is an example of what it will look like. I went ahead and went through the course just so that you guys can see what this looks like. But you can get a certificate of completion, not to be confused with CEUs and not to be confused with certification. This is a certificate of completion. CEUs are usually connected to continuing education units that you need to complete in order to keep a certification up to date. So if you are someone who is certified, with a HEMA or AAPC, there are CEUs that you may need to complete, continuing education units, in order to continue to be certified. That's kind of like self-explanatory in the name of that, CEUs. And a certification is you went through some sort of extensive training program, maybe anywhere between like 12 to 18 months, that required for you to complete a course, and you receive a certification after you sat for this exam. This here It's just a certificate of completion, meaning that you've completed the coursework. That is it. That is all. But still something that is very valuable. And as a matter of fact, it says it right here at the bottom of the certificate of completion that the certificate of completion does not entitle the recipient to CEUs and does not serve as an endorsement or license to counsel others in CMS. So just because you completed this doesn't mean that you can go now and teach a course on coordination of benefits. This is something for your own personal use that you can use for your own knowledge and to add onto your resume. So again, I'm not going to go through this course in detail. This is something that you can do at your own leisure, but I did want to show you guys where you can go and find some free resources. Let's do resume. And it's filled with tons of information. Again, they have the podcast that you can listen to, the FAQs that you can review. It has the video lessons in detail that breaks down coordination of benefits with Medicare. Also, all of the resources and the downloads. It's just filled with a ton of information, along with podcasts, frequently asked questions, resources, course downloads, so many different things that you can use at your fingertips. And the things that you would be learning inside of this course here will be things that you can add into your resume as bullet points, which I did here at the bottom of the resume here, where I added in relevant education, and also where I listed in the career highlights. I just more so focused on education. But the items that's listed here inside of the relevant education are very specific to what was learned inside of the coordination of benefits course at the CMS National Training Program, and speaking to very specific things and using very specific verbiage so that when a hiring manager reads this resume, and this is some of the first information that they're reading here in the career highlights, besides what's listed in the professional summary, but reading something that says completed CMS National Training Program on coordination of benefits, specializing in Medicare, Medicaid, TRICARE, and employer-sponsored healthcare plan coordination, in-depth understanding of Medicare as a primary and secondary payer, and experience managing insurance interactions, including end-stage renal disease, workers' compensation, and COBRA, and proficient in explaining health insurance terms to patients and verifying insurance details to support accurate billing and claims processes. Now, I just want to point out that with this other example, this second example that we have of a resume template that says insurance verification specialist resume, it doesn't even go into detail like this, right? This template here. And there's a lot of resumes that I see written when I've done resume reviews and rewritten resumes over that look exactly like this. And this is a part of the reason why when you are applying for different job postings, why your resume may not be making it through the system, because you're using very short bullet points. They're very succinct and straight to the point, but they're not detailed enough. They don't really stand out on paper. If I was reading this, and I just saw extensive Medicare and commercial insurance excellent familiarity with hospital and pharmacy environments, strong grasp of database integrity procedures. There really isn't anything too much here that stands out to me. Same thing with the professional summary. It does not stand out. You do not want to be the person using a version of a resume that does not stand out, because you're going to be overlooked and forgotten. You want to write your resume in such a way that you are speaking to the pain points and challenges of working in that position. And the more specific you can be, the better. So if you are working or applying for a position that is doing insurance verification in the emergency department, you would want to specifically speak to the pain points and challenges of doing insurance verification in that particular setting. If you were doing it in a pediatrics office, you would want to speak to the pain points or challenges of doing insurance verification in that particular setting, right? So for example, if, a mom comes in and let's just say, she's married and it's okay, both the husband and the wife have health insurance. Well, which health insurance plan is the primary? Who is the older of the two? Is it the husband or the wife? Is there any Medicaid insurance that is involved? Does the child have MCHIP? MCHIP is like a Maryland plan for children through Medicaid. These are questions that needs to be asked during the insurance verification process that some people tend to skip. Some people skip these questions on the front end, and it is a dominoes effect on the back end. It rolls through the middle of the revenue cycle all the way to the end of the revenue cycle when insurance verification is not completed accurately on the front end. So these are things that are extremely important. Some people think that like the front end positions are not important. They are just as important as the middle of the revenue cycle and the back end of the revenue cycle. I could say like the most important, because this is where it all starts. It starts at the very beginning when that patient is scheduled for an appointment. So I wanted to show you guys how you can use, let's go ahead and close out this certificate of completion. Okay. And this program, let's go back to training home. Let's go home here. But there is a ton of resources here, right? Let's go back to e-courses. If you were interested in fraud, waste, and abuse, I've spoken to people who said they were interested in fraud, waste, and abuse. If you're interested in fraud, waste, and abuse, and you don't know the first thing about it, then you could come over here to the NTP and come and review this course about fraud, waste, and abuse in its entirety. And then when you're done and you get that certificate of completion, then this will be something that you can add onto your resume. You can say, hey, I completed the CMS National Training Program course for fraud, waste, and abuse. And you can add some bullet points inside of your resume about what you learned in detail inside of this program. Okay, so this is a strategy or a tip that I like to give to individuals who do not have the education or a lot of years of experience to put in their resume, and they're interested in applying for a position and they're like, I don't have anything to say on my resume. Yes, you do, because there is a free course that was federally funded with taxpayer dollars that you and I have access to. You just have to go to the website and create yourself a profile so that you can begin taking advantage of some of the free courses that they have over here. All right, and number 3, last but not least, is HealthStream. Now, HealthStream, depending on what organization you work at, it's not going to look like this. This is just their sales page for companies that are interested in implementing it inside of their organizations. But HealthStream is one of the most widely used learning management systems in hospitals and healthcare organizations, and it offers a huge variety of training courses, certification tracking, and compliance training tailored for healthcare professionals. If you work at a large healthcare organization, more than likely you have access to HealthStream. And when you log inside of HealthStream, it is filled with tons and tons and tons of courses that you have access to at your fingertips and free. These are free courses. So if there's something that you are interested in learning, whether it's health information management, revenue cycle, data analytics, health IT, professional development, like public speaking, so many different things that they have in there. I mean, even down to how to master Excel, Microsoft Word, like all of the things. These are things that you could be using at your fingertips. And it just takes for you to log in and start using some of these free resources that are right at your fingertips that you can later go back and add onto your resume. Okay, so for instance, let's say you might be interested in learning about revenue cycle management and medical coding, or even leadership skills. HealthStream has courses on these topics that you can take at no extra cost. And these courses can help you to stay ahead in your field, whether you're just starting out or looking to advance into more specialized roles. It's a perfect opportunity to upskill without needing to seek external programs or paying any additional fees. So if you work for a company that is like nurturing your professional growth, use it. I cannot tell you how many people I've come across, and I've had a conversation with them and I'm like, hey, the company that you work at, do they have HealthStream? And they're like, oh yeah, like I've definitely like seen it, or I get like my annual trainings where I have to go in there and complete it. And I'm like, yeah, there's hundreds of other courses in HealthStream that you could be taking. You don't even have to go out here and find a course and pay for it. You could just do it like right at your job and get this free training, for free, for the free. So I did want to let you know about that as well. HealthStream is also something that you can use if you already work with the organization that is utilizing HealthStream. If you work for a large healthcare organization and you ask them about HealthStream, they're like, we don't have that. Ask them, do we have a learning management system? Do we use something else? And you guys might be using something different that's not HealthStream, but HealthStream is the most popular one. Every hospital that I've worked at has used HealthStream. Now, let's just take a moment to copy and paste what's listed here inside of this resume template example for an insurance verification specialist to see how it scores against the version that I wrote. Okay. I'm going to do upload and rescan, clear out the old template, paste in this one, and do scan. Now, as you can see here, same position, two different resumes. The last resume score we got with the resume we targeted and added in the keywords and the relevant education from the CMS NTP program, we got it up to a 79%. It started off at a 51 cent before we even identified what the keywords were. Went in, added in the correct keywords, and we got it up to 79%. The other resume template came in at a 33% match. And I want to narrow into how many years of experience this resume template says this person has. It says this person has been working in this position since 2006. This would be a resume of someone who I would say has an extensive amount of experience, several years of experience, worked in two different positions, and they have a bachelor's degree in business administration. But the way their resume is written, the applicant tracking system would not recognize this potential candidate as the best qualified candidate for the role, even though they have the degree, even though they have more years of experience. The ATS system would recognize this individual as a closer match simply because of how this resume is written, the keywords that are being used, and really leveraging and leaning in on the relevant coursework and education that's been completed. One of my favorite sayings is, if you went to school, you got a degree, a certification, anything of that sort, you didn't put in all this time, effort, and energy, blood, sweat, and tears to get this degree, certificate of completion, certification, whatever it is, to leave that information sitting on your transcript. You need to get that information over onto your resume and not just put it on there any old way. Because I've seen resumes where people have just simply just listed the name of the course that they completed, but did not put any details about what they learned inside of the course. You need to feed the applicant tracking system detailed information. And here is a clear view of what it could look like in the applicant tracking system when you use a targeted resume for the position at 79%. This is where we got it to, or an untargeted version of your resume and you have a lot of years of experience. This one came in at 33%. If both of these individuals were applied to the same exact position, the resume with the 79% score has a better chance of actually being selected for an interview. All right. So if you've made it this far in this video and you've had like any aha moments, like, oh my goodness, I didn't know that I could do this. I didn't even think about that. I didn't even know that this exists. If you had any of those moments as you was watching this video, I need you to do me a favor and drop a comment down in the chat, drop some fire emojis, drop some stars, something in the chat that let me know that you got some value from this video. Also, let me know what you would like to see more of from my channel. But I really hope that you enjoyed the information that I share with you inside of this video. I'll be dropping some links down in the description area that has the links to my resume templates, also the links to my resume writing masterclass that is 100% self-paced, and some of the resources that I use inside of this video. I'll drop it down below. And just a heads up, if you use any of the links that is to a different company, there may be a small commission fee that I get paid if you decide to purchase any of those services. So I do have to let you guys know that. But I really enjoyed putting this video together for you guys. There are going to be some people who go from struggling to getting interviews to actually being able to get interviews. If you're someone where you're just like, I just really don't like writing resumes, I don't have the time to try to figure all of this out, and you just rather have me write your resume, then I do offer resume writing services as well. Do not forget to like this video. Do not forget to save this video because you might need to look for it later. And don't forget to share it with someone else who's working inside of the healthcare industry that may need to use these tips, especially if they're still in school or recent graduate. There is some true gems that's embedded right inside of this video. Until next time.